Have a little fun, get some special guests in studio with us again. Cassie James joins us, the executive coordinator of the Blanche River Health Foundation, and she's brought Jorge VanSlyke, the CEO. Good morning, ladies. How are you?
Good morning.
We're just trying to stay warm, Fergie.
Try harder. Try harder.
I'm looking forward to that summer temperature you referenced for tomorrow.
Yeah. By the way, did you leave your vehicles running outside?
No, that might have been a good idea. Thank goodness for those fancy new apps.
Yes, indeed. Heated seats, heated steering wheel.
What app?
Hanging out for dear life. What app, she says. So we're here to talk about the Blanche River Health Foundation. Cassie, explain a little bit about why the foundation exists, what their role is in supporting the hospital and our community as well.
That's a good question. The foundation's actually been around since 1984, so almost the same age as me. And when the Kirkland and District Hospital and Englehart and District Hospital amalgamated back in 2020, the foundation became known as Blanche River Health Foundation. But in short, our goal is to raise funds for the two hospital sites. Healthcare is pretty complex when it comes to funding, and while the hospital does receive some government support, you might be surprised to know that the government support doesn't cover the cost of things like new equipment or upgrades. So that's where we are needed. That's where we come in. So every dollar raised helps enhance care for the communities that the two hospitals serve. Things like new diagnostic machines or even a comfortable space for families in their time of need. So it's a pretty important foundation, and I'm pretty privileged to be a part of it.
All right, so you said 1984.
Yes.
Since, man, that's a long time.
Yeah. Well, not quite that long. Come on.
Well, you're older than you think. Since 1984, let's give us, say, the two or three biggest things the foundation has accomplished.
Well, I have learned lots in this role, and the foundation has accomplished a lot. Actually, I think you'll probably remember Renovate a Room.
Yeah.
That was a huge project, started back in 2006. Norm Conley, fondly known as Uncle Norm, was monumental in moving that successful program forward. Over $400,000 was raised, and there are some really wonderful accomplishments around that. There was the Buy a Bed program back in 2002. Doug Cooper was the chair at the time and spearheaded that. There was 62 beds purchased. Over $300,000 was raised for that program.
Oh, wow.
We also have that new CT scan room and CT scanner. That was purchased by part of a donation from Kale Gold, which when Agnico Eagle took over Kale Gold, they picked up that project and are seeing those costs through. So those are some major projects that the foundation's been a part on. But as you can tell, the community really the foundation really relies on the community, the businesses. If it weren't for everybody, big and small, contributing a dollar or more, we wouldn't have those things happening in our town.
It all adds up. And that CT scan saved my life, by the way, earlier this year. That's a whole other story.
Well, we're so grateful.
George, let's bring you in here. So as a hospital CEO, do you sit there and talk to yourself and say, okay, George, the foundation needs this, and then you say, okay, George, we're gonna work on this for the hospital. How do the hospital and the foundation work together to address the needs?
Thank you so much for asking that, because the foundation has really been instrumental in the continued success of the hospital. So what happens is that at least once or twice a year, we do solicit input from our team, from our physicians, from feedback from our patients, and we have a master list of all our capital projects, the needs and the wants. And then from there, we do have a prioritization system, and depending on the amount and how easy to procure and how important it is to promote quality, then we approach the foundation and propose the 2-3 projects that the foundation would then approve to fundraise or to provide funding for.
Okay. As far as the hospital goes now, what are some of the current initiatives, like the masking guidelines? Where do we stand now with that?
So masking is very important. Right now, we had switched to an easier way to determine when to mask when you enter the hospital. So we're using the stoplight signs, so red, green, and yellow. When you see red, it means that everywhere in the hospital you need to mask. When you see yellow, you mask when you're in patient areas or when you're symptomatic. And when you see green, it's free for all.
A much easier system to understand.
That's right.
Much easier system to understand. Cassie, split the pot. I'm trying to win some money here. When's Split the Pot coming back?
Oh, you're going to be happy to hear this. We are launching the tickets sales starting January 30th, but they're changing it up this year. So in 2024, Split the Pot ran for 6 weeks every 3 months. Now it's going to run basically every month.
Oh, right on.
And they're going to have early bird draws every Friday. So there'll be more winners, more prizes, constantly able to buy tickets and win.
Will people ever be mad when I start winning?
That'll be a fun day.
Be winning 4 or 5 times a month.
I'll be interviewing you instead of you interviewing me.
Let's talk about percentage there, Fergie.
George will talk. Cassie, the auxiliary volunteers in the gift shop at the hospital, they've been around forever. How do they contribute to the fundraising efforts? What happens to monies raised there?
Oh, God love the auxiliary ladies. They are and men, I should say.
Yes.
The volunteers are amazing. They have been around for many years. We're so grateful to Lynn and her team. They keep the gift shop open Monday to Friday, and they sell so many things. So obviously the Nevadas, so definitely stop by the hospital, get your Nevadas. They have a wide range of items that aren't only just for inpatient or visitors, but for anybody. If you want to come and get some of the best gifts in town, come up to the gift shop. They often try and find local suppliers, and they're always trying to be really competitive priced. And of course, it's always tax-free. And then, yes, their proceeds are then donated to the hospital, just the way. So they're similar partners to us. They have the same mission as the foundation, and we work together to achieve a lot of similar goals.
Okay, we've got about 90 seconds left. What else would you guys like the community to know? What else can you share with us this morning?
So I just want to encourage our communities to continue to refer to the hospital because we still have a lot of positions that are critical to our operation, like physicians, obviously. Critical care nurses are very important. And also a reminder that when you go to the ER, please make sure you bring a list of medications to continue to do that. Then that way it will hopefully speed up the process a little bit.
So with the list of medications, I'm asking for myself with this one. With the list of medications, do we only have to do that once until we're entered into the computer system, and then we don't have to bring or do we have to bring our list of medications with every visit?
I would encourage to bring every visit because you'll never know what changed, and in that way you don't forget. And the last piece is also we continue to want to solicit your feedback, and if you have any concerns or compliments, please let us know. There's forms in the hospitals, so you can go to our website at www.blancheoverhealth.ca or call the number, the main line extension 3202.
Okay, Cassie. Last word goes to you. You guys are everywhere on social media. Tell people how they can find you.
Excellent. Yes, we are on Facebook, Instagram, and LinkedIn. All the links are on our website, which is BRHFoundation.ca. And I also wanted to say a huge shout out to everyone who donates or shares an article or social post. Each action is helping us achieve our mission.